Human immunity by Hannah Raines. Non-specific defences against disease. The immune system can be divided into three basic lines of defence against pathogenic infection. The first line of defence against infection, or outside defence system, are the surface barriers that prevent the entry of pathogens into the body. It contains physical and chemical barriers that are always ready and prepared to defend the body from infection. These include your skin, tears, mucus, cilia, stomach acid, urine flow, friendly bacteria and white blood cells called neutrophils, a type of white blood cell that forms a primary defence against infection. They can engulf and destroy foreign organisms. The second line of defence are the non-specific pathocytes and other internal mechanisms that compromise immunity. The third line of defence, acquired immunity. The third line of defence is specific resistance. The system relies on antigens, which are specific substances found in foreign microbes. The activation of T cells by a specific antigen is called mediated immunity. The body contains millions of different T cells, each able to respond to one specific antigen. The main function of immunoglobulins is to react against antigens in order to mediate their elimination. Immunoglobulins react with antigens in two different ways, bound to B lymphocytes forming the BCR receptor, which allows their reaction with antigens in their native form. Natural barriers against pathogens. The physical and chemical barriers that prevent pathogens from getting into our body's tissue in the first place are often overlooked, as figure 1 shows. The most comprehensive barrier is the waterproof layer of skin that covers the body's surface. Human skin keeps most pathogens out as long as it remains intact. The speed with which a cut or graze can become infected is a reminder of protection we normally get from our skin. See figure 1. Inflammation, fever. What is inflammation? Inflammation is your body's way of protecting itself from infection, illness or injury. As part of inflammatory response, your body increases its production of white blood cells, immune cells and substances called cytokines that help fight infection. Fever. A fever is your body's natural response to many common illnesses such as flu, tonsillitis, kidney or urinary tract infections, UTIs. Fever helps your body fight infections by stimulating your immune system, your body's natural defence. By increasing your body's temperature, a fever makes it harder for the bacteria and viruses that cause infection to survive. Role of macrophages. Macrophages are a type of white blood cell of the immune system that engulfs and digests cellular debris. Foreign substances, microbes, cancer cells and anything else that does not have the type of proteins specific to healthy body cells on its surface in a process called pathocytosis. Role of macrophages. See figure 2. The macrophage accomplishes its ongoing clean-up task by engulfing unwanted particles and eating them. As mentioned before, a macrophage is an ambia-type cell. Imagine like a jelly-like blob oozing along, surrounding its prey and swallowing it up. This is essentially how a macrophage works. Transplant immunology. Transplantation is the process of moving cells, tissues or organs from one site to another for the purpose of replacing or repairing damaged or diseased organs and tissues. It saves thousands of lives each year. However, the immune system poses a significant barrier to successful organ transplantation when tissues/organs are transferred from one individual to another. Rejection is caused by the immune system identifying the transplant as foreign, triggering a response that will ultimately destroy the transplanted organ or tissue. Long-term survival of the transplant can be maintained by manipulating the immune system to reduce the risk of rejection. Donor and recipient are carefully matched prior to transplantation to minimise the risk of rejection. They are matched based on their blood group, tissue, and how the recipient's blood serum reacts to the donor cells. Immunosuppressive drugs are used to prevent and to treat transplant rejection by dampening the overall immune response. However, immunosuppressive drugs are non-specific and leave patients more susceptible to disease, as well as being associated with numerous unwanted side effects. Specific immune system disorders, so rheumatoid arthritis. Rheumatoid arthritis is an autoimmune disease that most commonly affects the joints of the hands, feet, wrists, elbows, knees and ankles. Because rheumatoid arthritis also can affect organs and body systems such as the cardiovascular or respiratory system, it is called a systematic disease. The symptoms of the disease may come and go, and people with rheumatoid arthritis who closely follow an effective treatment plan can experience periods of remission, which means low to no disease activity. However, there is no cure for rheumatoid arthritis, so the disease requires ongoing monitoring and treatment as you engage in a healthy lifestyle and habits. Type 1 diabetes. Type 1 diabetes is also an autoimmune disease. It occurs when the pancreas can't make insulin because the immune system attacks it and destroys the cells that produce insulin. Children and teens with type 1 diabetes are at risk of other autoimmune problems, but these aren't caused by the diabetes. Doctors still aren't exactly sure why autoimmune diseases happen, but genetics probably play an important role because relatives of people with type 1 diabetes are more likely to have other autoimmune diseases. Active and passive immunity. Active immunity refers to the process of exposing the body to an antigen to generate an adaptive immune response. The response takes days, weeks to develop, but may be long-lasting, even lifelong. Active immunity is usually classified as a natural or acquired. Wild infection, for example, with hepatitis A virus and subsequent recovery gives rise to a natural active immune response, usually leading to lifelong protection. In a similar manner, administration of 2 doses of hepatitis A vaccine generates an acquired active immune response leading to long-lasting, possibly lifelong protection. Hepatitis A vaccine has only been licensed since the late 1980s, so that follows up studies of a duration of protection are limited to less than 25 years, hence the proceeding about the duration of protection. Passive immunity refers to the process of providing IgG antibodies to protect against infection. It gives immediate but short-lived protection, several weeks to 3 or 4 months at most. Passive immunity is usually classified as natural or acquired. The transfer of maternal tetanus antibody, mainly again IgG, across the placenta provides natural passive immunity for the newborn baby for several weeks or months until such antibody is degraded or lost. In contrast, acquired passive immunity refers to the process of obtaining serum from immune individuals, pooling this, concentrating the immunoglobulin fraction, and injecting it to protect a susceptible person. Artificial immunity. Artificial immunity is a mean by which the body gives immunity to a disease by internal exposure to small quantities of it. The most common form of artificial immunity is classified as active and comes in form of vaccinations, typically given to children and young adults. The passive form of artificial immunity involves introducing an antibody into the system. Once a person has already been infected with the disease, ultimately relieving the present symptoms of the sickness and preventing reoccurrence. Once the body has successfully rid itself of a disease caused by a certain pathogen, a second infection with the same pathogen would prove harmless. Naturally acquired passive immunity occurs during pregnancy, when antibodies are passed from the maternal blood into the fetal bloodstream. Immunity is transferred through the placenta in the form of antibodies, mainly IgG and IgA. Natural passive immunity can also be transferred through breast milk, and natural passive immunity is short-lived after the birth of the child. Immunological memory. Immunological memory is the ability of the immune system to quickly and specifically recognise an antigen that the body has previously encountered, initiate a corresponding immune response. Generally, these are secondary and other subsequent immune system responses to the same antigen. Immunological memory is responsible for the adaptive component of immune system. Special T and B cells to the called memory T and B cells. Immunological memory is the basis of a vaccination, the immune system and immunization. The environment contains a wide variety of potentially harmful organisms, pathogens such as bacteria, viruses, fungi, and multicellular parasites, which will cause disease if they enter the body and can multiply. The body protects itself through a various defence mechanism to physically prevent pathogens from entering the body or to kill them if they do. The immune system is an extremely important defence mechanism that can identify an invading organism and destroy it. Immunisation prevents diseases by enabling the body to more rapidly respond to attack and enhancing the immune response to an organism. The immune system and immunisation. Each pathogen has unique distinguishing components known as antigens. Have we just read this bit? No. Each pathogen has a unique distinguishing components known as antigens, which enable the immune system to differentiate between self, the body, and non-self, the foreign material. The first time the immune system sees a new antigen, it needs to prepare to destroy it. During this time, the pathogen can multiply and cause disease. However, if the same antigen is seen again and the immune system is posed to combine and destroy the organism rapidly, this is known as adaptive immunity. Vaccines utilise this adaptive immunity and memory to expose the body to antigens without causing disease, so that when then-live pathogen infects the body, the response is rapid and the pathogen is prevented from causing disease. Depending on the type of infection, the response required to remove it varies. For example, viruses hide within the body's own cells in different tissues, such as the throat, the liver, the nervous system, and bacteria can multiply rapidly with infected tissues. Benefits of vaccination by analysing measles infection rates in the UK between 1940 and the present day. So see figure 3. We've gone from 1940 to 2017. You can see the total amount of deaths and how it's decreased over time. Benefits of vaccination by analysing measles infection rates in the UK. After analysing the data above taken from Public Health England 2017, it's clear to see that vaccination against measles dramatically lowered the death rate in infants and adults infected by measles from 1941 to 2017. Prior to 2006, the last death from acute measles was in 1992. Since 2006, Public Health England 2017 has actively followed up all deaths certified as measles to establish the cause and any underlying conditions. So lastly, we're going to talk about herd immunity. Herd immunity, also called herd effects, community immunity, population immunity, or social immunity, is a form of indirect protection from infectious diseases that occurs when a large percentage of a population has become immune to an infection, thereby providing a measure of protection from individuals who are not immune. In a population in which a large number of individuals are immune, chains of infection are likely to be disrupted, which stops or slows down the spread of a disease. The greater the proportion of individuals in a community who are immune, the smaller the probability that those who are not immune will come into contact with an infectious individual. See figure 4. The top box shows an outbreak in a community in which a few people are infected, shown in red, and the rest are healthy but unimmunized, shown in blue. The illness spreads freely through the population. The middle box shows a population where a small number have been immunized.
Right.
Shown in yellow, those not immunised become infected, while those immunised do not. In the bottom box, a large proportion of the population have been immunised. This prevents the illness from spreading significantly, including to an unimmunised people. In the first two examples, most healthy unimmunised people become infected, whereas the bottom example, only 1/4 of the healthy unimmunised people become infected.